Hello, I am Dr. Amy Meyers. If you or someone you love is living with diabetes, I want to share something truly important with you today. Because managing diabetes is not just about sugar, insulin, or carbs. It is about habits. Quiet, everyday habits that seem harmless but can quietly raise your blood sugar, wear down your energy, and increase your risk of serious complications over time. As a doctor who has worked with thousands of patients facing chronic illness, I have seen one truth again and again. People are not failing because they are lazy or careless. They are struggling because they have not been told which daily patterns are silently harming them. That is exactly what we are going to talk about today. In this video, I will walk you through the top 7 bad habits that every person with diabetes must avoid. These habits are common. You may even be doing 1 or 2 of them without realizing it. But once you understand them, you can begin making gentle, smart changes that support better blood sugar, better mood, better sleep, and a better life. Let us begin. Because knowledge is not just power, it is freedom. Part 1, skipping meals or eating at random times. One of the most common and dangerous habits I see among people living with diabetes is skipping meals or eating at unpredictable times. It may sound innocent. You might think, I'm not hungry right now, I will eat later, or maybe skipping lunch will help me lose weight. But here is the problem. Your body, especially when managing diabetes, depends on consistency. When you skip meals, your blood sugar becomes unstable. Your body needs fuel at regular intervals. When you go too long without food, your blood sugar can drop too low. This leads to shakiness, fatigue, irritability, and cravings. And what usually happens after that? You end up reaching for quick carbs, bread, cookies, or juice, which send your blood sugar shooting up too fast. This roller coaster effect puts a lot of stress on your pancreas and makes your insulin work harder than it should. Over time, this pattern increases insulin resistance, which means your body needs more and more insulin just to do the same job. It can also lead to weight gain, brain fog, and even worsen diabetic complications like nerve damage and vision loss. Eating at irregular times creates the same problem. If one day you eat breakfast at 7 in the morning and the next day you wait until 11, your body never knows what to expect. Your blood sugar rhythms become confused, and your energy, mood, and mental clarity all suffer. So what is the better choice? Eat regular, balanced meals. That means 3 meals a day, ideally at the same time each day, with a mix of protein, healthy fat, and fiber-rich carbs. This helps stabilize your blood sugar and provide steady energy throughout the day. If you are someone who does not feel hungry in the morning, start small. Try a hard-boiled egg, a few almonds, or half an avocado. The key is to start the engine of your metabolism gently rather than forcing your body to run on empty. Your body is not a machine that runs better when it is starved. It is a living system that depends on nourishment, rhythm, and care. And when you give it that, it responds with better energy, better blood sugar, and better health overall. In the next part, we will look at what happens when you begin your morning with the wrong kind of fuel, and why your first meal can set the tone for the entire day. Part 2. Starting the day with carbs only and no protein. Let's talk about how you start your morning, because what you eat for your first meal of the day sets the tone for your blood sugar, your energy, and even your mood. One of the worst habits for people with diabetes is beginning the day with only carbohydrates, especially refined carbs. That might mean toast with jam, a bowl of cereal, a banana smoothie, or even oatmeal on its own. While these foods might seem light or healthy, they are mostly simple sugars that break down quickly in your system. What happens next? Your blood sugar spikes sharply. You may feel a quick burst of energy, but within an hour or 2, it crashes. This leads to hunger, irritability, shakiness, and intense cravings. usually from more sugar or starch. Worse yet, this spike and crash cycle causes your insulin to rise and stay elevated, which can lead to insulin resistance, fat storage, and eventually exhaustion. Now here's what makes all the difference. Adding protein. Protein slows the absorption of sugar into the bloodstream. It keeps your blood sugar more stable and helps you feel full longer. It also supports your muscles, your metabolism, and your brain. So instead of just a slice of toast or fruit, add some eggs, nuts, seeds, or plain Greek yogurt. If you like smoothies, make sure to include a scoop of plant-based protein or collagen protein to balance it out. Even a small amount of protein, 10 to 15 grams, can dramatically change how your body responds to your first meal. And remember this, if your blood sugar is unstable in the morning, it will be much harder to control it later in the day. When you begin with protein, you are not just feeding your body. You are giving your hormones, your brain, and your metabolism the tools they need to stay balanced. So tomorrow morning, ask yourself, is this breakfast going to fuel a crash or support my stability? In the next part, we will discuss a mistake that many people do not even realize they are making, and yet it is essential to managing diabetes properly. Part 3. Not checking your blood sugar often enough. Now let's talk about something that might seem small, but it can make a huge difference in how well you manage your diabetes. That is the habit of not checking your blood sugar often enough. I understand why many people avoid it. Maybe you do not like pricking your finger. Maybe you are afraid of what the number will show. Or maybe you simply forget. But here is the truth. When you do not check your blood sugar regularly, you are flying blind. You cannot manage what you do not measure. Think of it like driving a car without a speedometer. You might think you are going the right speed, but you have no way to know if you are going too fast or too slow until something goes wrong. The same goes for your blood sugar. Without regular checks, you could be walking around with blood sugar that is too high or too low and not even know it. That silent damage builds up over time. It affects your blood vessels, your nerves, your kidneys, your eyes, and your brain. But when you test often, you learn something powerful, how your body reacts to certain foods, to stress, to lack of sleep, or even to exercise. You might be surprised to see that one type of bread spikes you more than another, or that a night of poor sleep sends your blood sugar up the next morning. These patterns help you make smarter choices. So, how often should you test? That depends on your treatment plan, but most people benefit from checking before meals, 2 hours after eating, and sometimes before bed. If you're using insulin, your schedule might be more specific, and if you wear a continuous glucose monitor, you can learn even more in real time. The key is not to test out of fear, but to test out of curiosity and empowerment. Numbers are not judgments. They are information, and information helps you course correct early, long before complications set in. In the next part, we will explore a habit that may not seem connected to diabetes at first, but it has a powerful effect on your blood sugar, your hunger, and your long-term healing. Part 4. Sleeping too little or at irregular hours, one of the most overlooked but deeply damaging habits for people with diabetes is not getting enough sleep or sleeping at irregular hours. Sleep is not a luxury. It is a critical function that restores your body, balances your hormones, and regulates your metabolism. When you skip it or sleep poorly, your body responds in a way that directly harms your blood sugar levels. Let me explain why. When you sleep less than 6 or 7 hours per night, your body produces more cortisol, the stress hormone. Cortisol raises your blood sugar. It also makes your body more resistant to insulin, which forces your pancreas to work harder. At the same time, lack of sleep increases ghrelin, the hunger hormone, and lowers leptin, the fullness hormone. This makes you more likely to crave sugary or starchy foods the next day. Not because you are weak, but because your hormones are out of balance. Poor sleep also affects your immune system, slows wound healing, and increases your risk of heart disease, obesity, and depression, all of which are already higher in people with diabetes. Now let's talk about irregular sleep schedules. If you go to bed at 10 one night, then at 1 in the morning the next, your body cannot regulate blood sugar efficiently. Your circadian rhythm, your internal body clock, gets confused. That leads to erratic insulin release and fluctuating glucose levels, even if your meals stay the same. The solution is simple but powerful. Aim to sleep for 7 to 8 hours every night and go to bed and wake up at roughly the same time each day, even on weekends. Create a sleep routine that supports relaxation. Limit screen time before bed, keep your room dark and cool, and avoid heavy meals or caffeine late at night. Sleep is not optional. It is healing. It is the foundation on which your blood sugar, your energy, and your overall health are built. In the next part, we will explore a hidden factor that affects nearly every diabetic patient I work with, and it has nothing to do with food. Part 5, letting stress build up without releasing it. If you have ever noticed that your blood sugar rises even when you have eaten perfectly, you are not imagining things. That hidden culprit could be stress. Stress is not just a feeling. It is a physical event in the body. When you are under stress, whether from work, family, finances, or even your own thoughts, your body releases cortisol and adrenaline. These hormones prepare you for danger by raising your blood sugar. Why? Because your body still thinks stress means you need to run or fight, and to do that, it floods your bloodstream with glucose for quick energy. The problem is, you are not running. You are sitting at a desk, lying in bed, or holding back your frustration. So the sugar sits in your blood, and your insulin has to work harder to bring it back down. Chronic stress leads to chronic high blood sugar. It worsens insulin resistance, triggers inflammation, and can even disrupt your sleep, which we already know is harmful to glucose control. It is a cycle that keeps feeding itself. And here's the part most people miss. Ignoring stress does not make it go away. In fact, pretending it is not there often makes it worse. So what can you do? You cannot avoid stress, but you can learn to release it. That could be deep breathing for 5 minutes, walking in nature, praying, meditating, stretching, or even laughing with a friend. These small actions tell your brain that you are safe. They bring your body back into balance, and over time, they help your blood sugar stay more stable, even on difficult days. I often tell my patients, managing stress is just as important as managing your meals or your medications, because your body listens to your emotions as much as it listens to your food. In the next part, we will talk about a habit that even health-conscious people fall into, and why it can backfire if you are not careful. Part 6, eating too many carbs, even the healthy ones. By now, you probably already know that refined sugars and processed carbs are harmful to blood sugar. But what many people do not realize is that even healthy carbs, like brown rice, sweet potatoes, whole wheat bread, and fruit, can raise your blood sugar if eaten in large amounts. The problem is not just the quality of the carbs, it is the quantity. You might think, but it is whole grain, or it is natural, so it must be fine. And while these foods do offer more nutrients and fiber than white bread or candy, your body still turns them into glucose. And if you eat too much at once, your blood sugar will spike, sometimes just as much as it would from a less healthy option. This is especially important for people with insulin resistance or type 2 diabetes, because your body is already struggling to use glucose effectively. Adding a large load of carbs, even good ones, can overwhelm your system. What makes this worse is when carbs are eaten without enough protein or fat. This leads to faster absorption and higher spikes. You may feel full at first, But then comes the crash, followed by cravings, fatigue, or brain fog. So what is the better approach? Focus on balanced meals. Include non-starchy vegetables, a moderate portion of complex carbs, and always pair them with lean protein and healthy fats. This slows digestion, reduces blood sugar spikes, and helps you feel full longer. And remember, you do not have to eliminate carbs completely. You just have to be smart about them. Use smaller portions. Choose low glycemic options like lentils, quinoa, or berries. And pay attention to how your blood sugar responds. Everyone's body is different. Some people can handle oatmeal in the morning. Others feel better saving their carbs for later in the day. The key is personal awareness, not fear. Carbs are not your enemy, but eating too many of them, even healthy ones, can silently sabotage your progress. In the next part, we will uncover one of the most dangerous habits of all, because it is based on a lie that many people with diabetes have been told for years. Part 7, relying only on medication and ignoring lifestyle changes. Now we have come to one of the most important and misunderstood habits of all, relying only on medication while ignoring the power of lifestyle change. Let me be clear. Medication can be life-saving. It plays an important role in managing blood sugar and preventing complications. But here's the truth that many people are never told. Medication is not a cure. If you take pills or insulin but continue to eat poorly, sleep little, skip meals, stay stressed, and avoid movement, your condition will likely get worse over time. You may need higher doses, more prescriptions, and eventually face complications like nerve damage, kidney failure, or vision loss. The real transformation comes when you use medication as a tool, not a crutch. That means also committing to changes in how you eat, how you sleep, how you move, and how you think. It means learning your body, becoming aware of your patterns, and making small adjustments that build lasting strength from the inside out. The good news is that lifestyle changes do not have to be dramatic. Even small steps, like walking for 10 minutes after meals, adding vegetables to each plate, turning off screens an hour before bed, or drinking more water, can make a real difference. These changes lower your need for medication, reduce side effects, and support healing at the root. I have seen many patients reduce or even eliminate their need for diabetes medication through consistent lifestyle work, not by perfection, but by commitment. So ask yourself, are you waiting for your medicine to do all the work, or are you ready to partner with your body and take an active role in your healing? Because the path to better health is not found in a bottle alone. It is found in you. And now, let us bring it all together with a few closing thoughts. We have covered a lot today. 7 habits that may seem small, but when repeated day after day, can quietly push your blood sugar higher, drain your energy, and put your health at risk. Maybe you saw yourself in one of them. Maybe in all of them. That is okay. This is not about guilt. It is about awareness. Because awareness gives you the power to change. You do not have to fix everything overnight. You do not have to be perfect. But you do need to pay attention to your meals, your stress, your sleep, your movement, and how you feel each day. Diabetes is not just a blood sugar issue. It is a full body conversation. And here's the beautiful part. When you begin to shift your daily habits, even just a little, your body will meet you with healing. Your blood sugar will become more stable. Your mind will become clearer. Your future will feel brighter. If you found this video helpful, please click the like button and tell me in the comments which habit surprised you the most. Do not forget to subscribe and turn on notifications so you never miss a message that could change your health for the better. Stay informed, stay empowered, and I will see you in the next video.